Hello, this is Aaron Shoemaker, and I'm here with Julie Schneiders, who is the Executive Director at the Women's Center at Carmel. And we're here today to talk to you about the Pelvic Health Program. So, Julie, what is the Pelvic Health Program?
You know, the Pelvic Health Program is an idea that is part of a kind of a statewide initiative that we want to do to address these very personal problems that women have, that maybe you as a provider have tried some things and it doesn't work, and we might have some different ideas. So the Pelvic Health Program is got a nurse practitioner who is, her primary interest is in female sexual medicine. There's a urogynecologist who deals with, a lot of people think of urogyn and they're thinking surgery. Not necessarily. The nurse practitioner can deal with overactive bladder, urinary incontinence. These are all things that sometimes don't get covered on the annual exam when people come into their office, and they're very embarrassing. The other thing that I deal with a lot is menopausal medicine. We all know that menopause in the past however many years is kind of on the back burner. What do you do with it? People are still having hot flashes, they're still having lots of issues. And so I primarily keep my practice, I'm a women's health nurse practitioner also, I keep my practice to dealing with that. Kara does female sexual medicine consults. She has an interest in vulvovaginal conditions. We actually have vulvoscopy that she can look at the vulva for maybe lichen sclerosis, lichen planus. She does all of that. And then we have Kate Copeland coming in there who does a lot of surgery, works with our gynecologist, and also does just some medical management, because it's not always that. I mean, maybe it's a pessary fitting that Kara or I do.
Right. And I think you have physical therapy too, which I know is often hard to know where to go to as a referring provider.
You know, as we are very lucky at St. Vincent, we have pelvic health specialists and physical therapists. We have 2 at Carmel. They have some in Indianapolis. There's some in Fishers. So we are, and even other places. So I think it's important. Patients can self-refer to a physical therapist, okay? Mm-hmm. So I think it's important that if it's for one of those reasons, maybe it's incontinence, maybe it's pain with intercourse, if a patient makes a referral there or a clinician makes a referral, that you want to get that person that does have that specialty.
So how do we access these services? How do we get to you?
I think the best thing to do is to use our nurse navigator, Carol. I find that a lot of these conditions maybe need a little bit of discussing over the phone and what has happened prior. So I have my Carol LaRue, and you can reach her at 583-4437, and she will then deal with the office and get you in to the right person.
So if we have questions really, or we're just not even sure whether this is the right service for our patients or not, just call the navigator number?
Absolutely. Just call the navigator number, 317-583-4437.
Great. And we'll attach that to the email that we send out so everyone can have it. One other question I had in talking with you, should we just refer to urology for these things, or is there a time when maybe it's right to go ahead and send it directly to the Pelvic Health Program?
Okay, so urogynecologist, as everybody knows, has training in urology and training in gynecology. It's a great merging of a specialty. So some physicians will refer right to Dr. Kate Copeland. Many times if it's incontinence, overactive bladder is a common thing that women have, the referral will come in and Kara or I will take care of that. We do have urodynamic testing there, and that is something like, if we're trying to figure out, do you have overactive bladder, do you have stress incontinence because you've had so many babies that you might need a surgery, that's where the urodynamic testing comes in. So we also have that. We have a lot of different modalities within the office to kind of look at that and help us to decide what needs to happen next.
Figure out where to go.
Yeah.
Great. Well, thank you for talking about that with us today. So we have the Women's Pelvic Health Program that's centered out of Carmel, something that we can access for our whole state through referrals. We're going to send out with the email that goes out on this video the number for the navigator, and we'd love to see our physicians and nurse practitioners use that as much as needed. Thank you.
Thank you so much.